Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Multiple choice question. A patient whose asthma is well controlled will A. Maintain peak expiratory flow at least 90% of the predicted value. B. Experience no more than 2 asthmatic exacerbations per year. C. Take no more than 2 controller medications on a regular basis. And D. Wake from sleep with asthmatic symptoms no more than twice per month. And the answer is D. Wake from sleep with asthmatic symptoms no more than twice per month. To review well-controlled asthma has the following features. No more than 2 days out of the week needing a rescue bronchodilator for relief of asthmatic symptoms. No more than 2 nights per month waking from sleep due to asthma. Lung function 80% or more of predicted or of personal best value. And asthmatic exacerbations requiring urgent care or oral steroids no more than once in the past year. Unlike asthma severity, the assessment of asthma control is independent of treatment regimen and specifically of the number of controller medications that the patient is taking. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.